Yeah, so today I want to talk about the bioenergetics of Lyme disease. Essentially, how these bugs, these Borrelia, avoid treatment and stay alive. So let's go to the next slide. So I always like to give a roadmap of where we're headed, what we're going to talk about. So I want to talk about survival of the fittest, what's going on with these bacteria, Borrelia. I want to talk about light communication and how the bacteria talk to each other. We're going to talk about bacterial synergism and how different bacterial infections can create a team, create a network, and exacerbate things. And then lastly, quorum sensing, what that term means, because it's kind of a mouthful, and how it affects any of those patients dealing with Lyme disease. So let's go to the next one. All right, survival of the fittest. I never like to think about dealing with an infection as too much of a war, because I think it creates some false connotations about what's going on. But, you know, as one of the other doctors in our clinic here at Biologix, he always likes to view it as a chess match. I mean, because that's what it is. You're playing chess with the bacteria. Only one of you is going to survive to the fullest, right? And that's the one who's more fit. And so Borrelia burgdorferi, they're living creatures. They want to survive. They want to live. They want to thrive, just like we do, right? They don't want to go anywhere. If they've found a good host, they don't want to leave. They want to stay and set up shop. So many Lyme patients, they know this, right? You've been battling Lyme for 6 months, 1 year, 10 years. And it's because they want to survive too. They don't want to go anywhere. And so in order to survive, these bacteria, they'll adapt, they'll overcome, they'll improvise to their environment. They communicate with each other. They form communities within themselves and other bacteria, and more than just bacteria, other organisms, which we'll talk about later. So if you're dealing with Lyme disease, one way you can really enhance your treatment is to understand Borrelia's will to live, to understand the mechanism it uses to survive so that you can better heal. So let's look at that a little bit more. Let's go to the next slide. Communication, right? So any long-term relationship, anyone who's been married knows, or even long-term working relationships, you have to be able to communicate, right? And Borrelia, there's not just one Borrelia or any other bacteria. There's a bunch of them, right? So they have to be able to communicate and coordinate. And one of the major ways they do this is through light. So if some people have different types of like fiber optic cables for their internet, like Google Fiber or AT&T Fiber, and that's basically using fiber optic cables to bring the data in. Well, that's transferred over light. That light is bringing all that data into your house and your computer, and then sending it back out when you send something back to the internet. Bacteria use that same system. They use light molecules, we call those photons, to pass information back and forth, right? So these light emissions they use, these photons, are species specific. So Borrelia has a certain light frequency that it communicates at. Bartonella, Babesia, well, Babesia is technically a parasite, but Mycoplasma, Streptococcus, they all have very specific photons they use to communicate with each other. And so this helps the bacteria to find food. So if some bacteria over here find somewhere they can eat, a good source of collagen, for instance, for Borrelia, which loves to eat collagen, connective tissue, then they'll send out those light molecules and draw more bacteria that way. They'll help it avoid treatment. So if the immune system is starting to figure out what's going on, they'll send out these photons and let the bacteria species and the other bacteria know, hey, they're starting to on to us, we need to do something different. It also helps them move around the body. So, you know, different areas in Borrelia, people have pain in one area one day and somewhere in the next. So that could possibly be Borrelia shifting areas, right? The bacteria is moving. Well, the way it does that is something had to tell it to move, and that's the Borrelia communicating with each other through these photons. A lot of people don't really recognize how specific these things get. So for instance, we can measure the frequency of Borrelia, which measures at 636.12 hertz. And that's just like, it's almost like a radio station. If you're off a little bit, right, you don't get the radio station. Maybe it comes through partially, or maybe it comes through staticky or not at all. It's the same for these bacteria. They're communicating very, very specifically, excuse me. And so we want to be specific with our treatment. So let's look at ways we can deal with this and how we can modulate this light communication to support your healing. Let's look at the next slide for that. So how do we disrupt their communication? So if they use light to stay alive, we can use light to help clear them out, okay? So in our clinic, we use a lot of energetic methods to do this. And by energetic, I just mean we're using some sort of a frequency, some capacity to do work to clear them out. So we can use energetic testing methods to see what the light effect is on the body in dealing with the microbe, right? So if we expose somebody to a microbial frequency, and then we expose them to, let's say, red light, which is 65% of the eye's photoreceptors, right? And we can see, does that strengthen the body in the presence of this microbial field? Does it have no effect? Does it enhance the Borrelia? And then as we start to sort that out, we can actually go through and start to balance the body with the microbial field and the light element. So in our clinic, our founder, Dr. David Jernigan, he came up with a system known as neurophotonic therapy. It's basically looking at the way our nervous system and body use photons. And if it's imbalance or dysfunctional, bringing back into a state of balance. So we can use that neurophotonic therapy to see, okay, in the presence of red or green or blue or violet or other colors, does the body weaken or strengthen? Which systems within the body weaken or strengthen? And what effect is that on the immune system specifically and the way it's dealing with things like Borrelia? And so not only can we apply those lights in a therapeutic fashion, so potentially maybe red light would be therapeutic by itself. It'd help the body deal with the Borrelia. But further, we can enhance and balance the way the body uses that red light to strengthen it moving forward. So now we know the immune system will be stronger moving forward with the immune system. So further biofeedback testing, it allows us to see which types of light strengthen the body in that way, and especially which bacterial frequencies might be hiding based on that light. So as we'll talk about a little bit later, we know that some of these infections can be hard to find. Well, one additional way to see if the body's responding negatively to some of these bacterial frequencies is to expose the body to different types of light and see what's going on with that. And so it helps us to find more disruptors, more bacterial frequencies that are disrupting the immune system or disrupting the body. Now, we can further utilize light with things like frequency-specific laser therapy. So you can take something like that frequency of Borrelia, like 636.12 hertz, and you can apply that in a frequency-specific laser and treat the body with it. You could invert it, you could amplify it. You could do things like that to treat the body with that. So we know through research that laser therapy, it helps to heal the mitochondria, it's anti-inflammatory, helps to decrease free radicals. We know it supports the immune system in healing tissues, increases blood flow. So we can focus that using frequency-specific laser therapy to disrupt some of their light communication, disrupt what these bacterial frequencies are doing in the body, and at the same time enhance the immune system, enhance these body systems. It's quite amazing when you really can get that precise with it. And some of the energetic testing methods like we use, like biospectral testing and things like that, really help us to hone in on that one. Let's look at bacterial synergism next. Let's flip on. Okay, bacterial synergism. Synergy is essentially a word that means, two things working together, like two different types of bacteria, for instance, Bartonella and Borrelia, working together to enhance their system. So Stephen Covey always said 1 + 1 = 3 or more when we talk about synergism, working together as people. But bacteria do the same thing because we got to remember they want to survive too, right? So they're going to use some of the same methods we will. So time has shown that Lyme disease is often more than Borrelia infection. It comes with a whole host of co-infections. So, we could list all of these: Bartonella, Mycoplasma, Ehrlichia, Anaplasmas, the HHV family, HHV6, CMV, Babesia parasites, right? We know that different ticks can carry those, and other vectors can as well. Mosquitoes and spiders and things like that can bite you and move Lyme disease and these other bacteria. So we want to make sure that we're addressing all of those. So as a synergistic fashion, these bugs work together. So when they do that, they make each other stronger. So they actually increase the effect of each type of bacteria. They weaken the host. So one way, like in a tick bite, if that tick's just carrying Borrelia, the ability for it to transfer the Borrelia to you, for that Borrelia to leave the tick and go to you as a human, is lower. But if it has multiple types of bacteria in it, let's just say there's Bartonella and Mycoplasma inside that tick as well. Now they can synergize and work together to confuse and overwhelm your immune system to allow you to take on those infections. right? They can get sneaky now, and they can get cunning. And so they're going to infiltrate the host much better. And so doing that, they can exacerbate the symptoms because they make each other stronger. Now there's more infections. And the symptom, maybe for instance, joint pain from just one of the infections now is exacerbated multiple fold, not just because there's more bacteria, but because they're enhancing each bacteria's effect. And thereby we perpetuate illness, right? So the mechanism, if it wasn't creating so much suffering in my patients and it wasn't creating so much suffering in people's lives, from just a biological and microbial perspective, it's quite fascinating, quite beautiful, the idea of like, wow, these critters can work together. They can fashion a teamwork, a network to both almost like, what's that movie, Ocean's 11 or whatever, where they do this whole bank heist or casino heist or whatever. I mean, it's really like that. They're putting this plan together to get into the system. You have to respect that a little bit. And if you're not respecting it, then you're not taking your treatment seriously. So here's some things we can do about it. Let's go to the next slide. So how do we break up the band, if you will, right? So what we want to do is we have to support the immune system dealing with the multiple microbes. So it's helpful to know what the body's dealing with. Okay, if you didn't know a mycoplasma infection was involved and you never directly address it, what you're doing for Borrelia or Lyme disease, it might be clearing the Borrelia, but you won't get totally better because you still have this mycoplasma load to deal with, okay? So it's helpful to figure out what other co-infections are you dealing with so you know how to address them specifically. So once you start dealing with them specifically, you have to decide when you're going to specifically help the body and the immune system deal with those guys. So you want a way that you can immediately test the body's response to treatment, right? So you can know, because of synergistic effect, usually there's going to be one bacteria that's playing the lead role at the moment because it's the one eating the most, it's the one taking control the most. And if you start to support the immune system in dealing with that, its numbers might go down and its strength might go down, but your symptoms might flip-flop a little bit because now let's say Bartonella starts to take the lead, okay? But if you're not prepared to deal with that, you might spend weeks or months suffering. And so you need some sort of real-time testing to show you what's happening in conjunction with treatment. So as you support the body with, let's say, an herbal protocol or induced native phage protocol or something like that, you need to understand that some other hydra is going to take this guy's place if you're not prepared for it, okay? So that's where our testing at Biologix Center comes in, that is biospectral emission sequencing, or biospectral testing for short. It's a biofeedback adjunctive diagnostic system. It's a whole bunch of words there. But essentially, it's a way for us to test very quickly in real time what the body's response is, so we know how to adjust our treatment to the body for what it needs in that moment. So if something else does creep up, we're supporting the body and dealing with that next, okay? So you need something in real time to help you with that approach. You want to stay ahead of these co-infections as they're coming up. Now, some of them may be hiding, and we'll talk about that more later. They might be living in parasites. Katie, can you hear me okay? It gave me some weird mute thing.
We can hear you. We can hear you.
Okay, great. Okay, sorry about that. So as like, let's say the Bartonella is really low level in your body, but if Borrelia is taking the lead and you start to push that down, Bartonella is smart too, and it's going to say, wow, now I've got this host that's free and ready for me to come on board and just start chowing away and thriving. And so it's going to start to proliferate. And it may have never even been on the radar because it was so low level before. And so you need to figure out how to address that. And so that's what a real-time testing like biofeedback, like biospectral testing gives us, is a way to monitor that right away so we can test for synergism. You really also want to modulate the host immune system. So you don't want an inviting environment for these critters to live in, right? So you need to have lifestyle in check. You don't want to be eating a bunch of junk food. You don't want to be living in a bunch of EMF. You want to be trying to eat as much fresh and local grown food as you can, things like that, so that your environment that you're creating for them is not optimal to live in. And then you want to be supporting and potentially upregulating or modulating your immune system so that they can be addressing any of these guys as they pop up as well. And I put it here, don't give them a reason to stay, basically. If you've got a bad house guest and it's time for them to go, You don't want to be making them dinner at night. You don't want to be giving them a turn down service with a check on their pillow. You want to let them know it's time to go, and you want to do it in not so subtle hints, right? Same thing with our body. Don't make it an easy place for the Lyme bacteria, Borrelia, or other co-infections to hang around. Let's look at what's coming up next. QUORUM sensing. QUORUM sensing is a fancy research term that basically helps support bacterial synergism. It's a way for the bacteria to communicate, kind of like the photons, within their own species and other species. So that means Borrelia can communicate within itself, and it can communicate with Bartonella or Mycoplasma or Babesia, okay? And so that allows, kind of like we talked about, for better transitions, allows them to move from host, from tick to tick, or potentially, like we're starting to see more and more research, like in utero transfer from mother to child or between, spouses or whatever. This QUORUM sensing allows them to do that. They can tell in the environment that there's an opportunity, and so they can start communicating and, again, planning their heist to shift over. So they can overwhelm the immune system, trick it, and move past it. So let's go to the next slide. So the other thing QUORUM sensing does, and it's basically communication between bacteria about what's going on in the environment, is it allows them to enhance biofilm formation. Okay, you can think of biofilm as like they're hunkering down and building their fort. They don't want to have a temporary stay, right? So like when the Vikings invaded Europe, they wanted to start having some more stationary areas later on. They wanted to start developing farms and things along the coast, communities. Bacteria do the same thing. They've invaded. Now they want to stay. They want somewhere to live. They don't want to be there temporarily. So biofilm allows them to have protection from the immune system and treatment, gives them a great place to grow and repair, gives them a station to move from, and someplace they can feed, right? They can eat. It's much easier to sit down and have dinner inside your own dining room than it is to try to eat in a hotel room, right? So it allows, this QUORUM sensing allows different bacteria to take the forefront, like we were talking about in their synergism. So they can sense the environment, say, hey, the environment for Borrelia is no good right now, right? The host is changing. Let's allow Bartonella to be the lead for a little while until the environment changes back. And then Borrelia can take the lead again. And so it's allowing it to adapt and shifting as the environment shifts. It's quite cunning. It's quite amazing. So with this front, the Borrelia or the bacteria could say, right now in this area we're in, there's more food for Borrelia than there is Bartonella. So let's let Bartonella relax in the biofilm and let's release Borrelia so it can eat, right? Or it can proliferate, it can grow, it can multiply. And so they'll shift and they'll keep shifting like that. And the way they'll use this biofilm is they'll do whatever they need to. It's got mucus in it and proteins and heavy metals and different things built up to protect itself, whatever it can harvest and create from the environment to protect itself. Not only that, but Borrelia specifically is fantastic at QUORUM sensing. It is a environmental ninja, right? So it can scan the environment and it'll do what's called like antigenic shifting, okay? It'll change the proteins on the outside of the bacteria, on the Borrelia, so that the immune system can't find it. It's basically put on in the skies. It says, hey, we were looking for a guy with a mustache and brown hair, and there's somebody who kind of fits the description, but now he has blonde hair and he's shaved. That's what the Borrelia is doing. It's shifting as often as it needs to. It's really good at this. The other thing Borrelia does, and other bacteria do this as well in some of the co-infections, but Borrelia does this really well. It'll shift from its spirochete form to a cyst form, okay? And it can do this instantly. I mean, man, the second antibiotics hit that bloodstream and spirochetes come in contact with it, within seconds to minutes, that's shifting into cyst form, which is very hard to kill at that point, okay? And so it's protecting itself. And later, sometimes it's called a bleb form because it looks like a blob. And later, when the environment comes back again, QUORUM senses the environment, turns back into a spirochete so it can go back along its business. So how do we disrupt this? What do we do about this? Let's look at the next slide so we can talk about it. Well, number one, you could break down biofilm. And I highly, highly recommend, with lots of precaution here, that you do this mindfully. Do it slowly, do it strategically. If you just start blowing up biofilm, you're going to release all sorts of bacteria in your system you may or may not be ready for, okay? So you want to do this very strategically. I typically won't mess with it until I need to, right? Until we've done what we can do without messing with it, and then we do it very slowly. So you could just degrade the biofilm with enzymes. You can break them down. Things like NAC or EDTA can chelate and pull things out of the biofilm to disrupt it. You can do biofilm penetrators. Different herbs penetrate or break down the biofilms. Essential oils will seep through the biofilms, right? So that's helpful. But do it, like I said, very strategically and harmonize it with what your body wants and can adapt to, okay? Now, there's also a competitive side of quorum sensing. So, we talked about the synergistic side, but also these bacteria are sensing, the quorum sensing their environment to compete with other bacteria. Do they want to kill that bacteria? Do they want to try to out-eat that bacteria? And so we can use that to our benefit with probiotics, right? We can inundate the system and target the system with certain probiotics that we're using to basically use that environment. So then the other bacteria now have to compete with the good probiotics we're putting in. And then again, we can use a biospectral testing to see exactly which probiotics strengthen the body in the field of like a Borrelia microbe, a frequency, right? So if the body's reacting negatively to Borrelia frequency, we can see is there a probiotic that strengthens the body, and we know it's going to start competing with that Borrelia. You can also use fasting to starve the bacteria, right? You can change the environment. So they're looking for food to eat. If you starve them out, if you use fasting, again, consult your healthcare practitioner with this front, but it helps to starve the bacteria, okay? Because they're looking for food too. And you can focus on wholesome foods. You don't want to feed them junk, right? Don't feed them the sugars and things they want to eat on. You can pulse and update treatments as often as needed, right? Don't stick to something if it's not working anymore. You might need to update it, take a break from it, pulse it on and off, 2 days on, 1 day off, take weekends off. Sometimes you can come back to a previous remedy that quit working because the quorum has shifted, right? The environment shifted. The bacteria move around. So that same treatment that's quit working might start working again. And you just want to do the smart thing of supporting a healthy immune system, right? That's your major defense system. So let's support it so it's always on its game because it's brilliant too. It can utilize, our immune system utilizes quorum sensing to figure out what's going on. So we want that tip-top shape because that's going to be better than any treatment we can give, is supporting the immune system. It's so intelligent that we want to make sure it's in tip-top shape. And we can use frequency-based remedies and real-time adjustments to help the body update its immune software, right? So essentially what I'm saying there is in the treatment room, if I recognize that a patient's, the microbial environment, if you will, is shifting, right? They were dealing with a lot of Borrelia. We supported the body. Now the Borrelia is taking a back seat and something else is showing up. Well, we can also do real-time like frequency-based medicine. So that means I might do some laser therapy, or I might do some like acupressure, or I might do different energy techniques or some homeopathy, something to basically show the body the shifts that is changing so it can keep up. That's really us kind of updating the immune software to the changes so we can stay up to date and adapt as well. A healthy body is a body that adapts. And so what we're always doing in the clinic here, and you want to be doing in your treatment, is getting your system, because it's so intelligent, to adapt. If it can adapt, it can stay ahead of the game. Let's look at the next slide. So as we talked about a few different things, right? Survival of the fittest. We talked about quorum sensing, bacterial synergism. We talked about communication networks. So how do we put this all together? Well, the bioenergetics of Lyme disease, it's really about the capacity of these bacteria to do the work of surviving inside us, right? Energetics, energy means the capacity to do work. So bioenergetics is how these microbes are biologically shifting their ability to stay alive and do work inside of us. So we have to be intelligent and stay up to date just like they are. So we're blessed rationally and subconsciously in our body's wisdom to learn, adapt, overcome, improvise, just like they can. There's no point in sitting and doing the same thing if it's not working. Play the same game they are. Play chess just like they are. So just in this same vein, for us, innovation is a major cornerstone of our clinical approach. We're always trying to innovate with patients on two fronts, right? Over the long run, or the long haul. And that's why we've come up with, we call it the macro scale. So shifts in treatment like neurophotonic therapy, neurocardial synchronization, different forms of biofeedback, induced native phage therapy, things like that that we've innovate at a large scale to help the body and stay ahead of this chess game, but also on the micro scale, real time from day to day. So when patients come, they see me every day for 8 to 10 days or 4 to 8 days in a row. And so we can make adjustments in that time frame, in that office visit and day to day to the body and to the treatment protocol, so that we're innovating. I might come up with something new just for that patient so that their body's ability to adapt, right? We want to learn, adapt, overcome, improvise. We need to be doing that every day, and that's what we're doing in here. And that's what you can do and take home with you is as you're trying to deal with these guys, you want to be allowing yourself to learn about what's going on, seeing the patterns, and how can you adjust to support those patterns. So really take some time to learn about what's plaguing you. I don't want to overactivate your limbic system and turn.
It seems we may have lost Dr. Hart. So we're going to pause for a second. I just, I'm scrolling through the participant list and he is not there. So thank you for your patience. If you've been perhaps holding on to a question that you'd like to make note of now, it would be a great time to do that. And hopefully he'll rejoin us momentarily. I do apologize for the inconvenience. That was his last slide. So when he rejoins, we'll let him finish that thought, but we will be transitioning to our Q&A after. Again, I do apologize for the disruption. Still just waiting to see if he's able to get back into the meeting. Still nothing yet. Thank you for your patience again. Every now and again, something happens. You like to keep it interesting, not usually this way. All right, I'm going to go ahead and mute myself momentarily and see if I can get in touch with Dr. Hart another way. Again, I apologize for the disruption. Bear with us and we'll see what we can do here. I'll be right back with you. All right, Dr. Hart managed to log back in.
All right, thought I'd leave you guys on a cliffhanger there.
Yeah, hang tight. Let me just, I know that was our last slide, but let me go ahead and reshare and we'll wrap up strong. We're, we can handle this.
Deal.
Talk about adapting. We like to adapt.
That's right.
Vital. Here we go. All right, you good?
Yeah, okay.
Great.
Oh, I think I was kind of saying I don't want to overactivate your limbic system, meaning I don't want you to over stress about trying to know every little detail, but it's helpful to understand your opponent, right? So if you're going to play a chess grandmaster, you'd want to know their moves. And so we want to know Lyme disease and its co-infections moves as best we can, so we can adapt our treatment to that. And so if you're doing that both in real time and as an overall approach, I think you're going to have a better outcome. And you're going to see that you can actually get ahead of these guys instead of always feeling like you're one step behind. And so the idea there is, don't get stale and rigid. Don't get too stuck in what you're doing. Hold some of your, what I might call your treatment beliefs a little bit loosely so that they can be updated, they can be adapted to what your body needs, or in my instance, what a client's, a patient's body needs in real time. Yeah.
Great. All right. Go ahead and stop sharing and we can move on to some questions. I know we have some people on our call. Hold on, I'm going to, let's see here. Dr. Hart, I just want to make sure that you are spotlight here. Okay, all right. We have some people on this call who have not joined us before. So just to overview, again, Dr. Hart is with the Biologix Center for Optimum Health in Franklin, Tennessee. I'm assuming, hopefully correctly, that some number of you on this call might be all too familiar with Lyme disease, and perhaps that's why you're joining us. Again, I would be happy if you'd like to reach out to me directly. I can provide contact information for the Biologix Center. And my colleague Chris is on the call. Chris, if you wouldn't mind taking a minute as well and maybe putting that in the chat box for those of you who are interested, hopefully we can save you a little bit of work here. And Dr. Hart, correct me if I'm wrong. Hopefully I'm not. But it's my understanding that you and your colleagues have been quite effective in improving quality of life for patients suffering from Lyme disease and related illnesses. Is that right?
Yeah. So, a number of years ago, we ran some quality of life studies and shown that most patients come out with improvements in at least 80+% of their symptoms over a 2-week period. And that's just the initial 2-week treatment. We did just release a study using some different lab testing for Borrelia, showing how some of the treatments we innovated here were able to clear the infection of Borrelia. Initially, in 77% of the patients, it totally cleared the infection. And over a couple of repeated treatments, 90+% of the patients clear the infection. So for us, quality of life and as far as supporting the immune system directly with Borrelia, yeah, if I'm being kind of a humble brag, we're very successful at that.
And I do have some questions from participants. And again, I'd invite others on the call to go ahead and you can, any questions that come up for you, please do put them in the chat log. We will get to them. But as you're talking about the treatment offered at Biologix, one of the unique characteristics is that you do tend to prefer these longer stays for patients. And in your talk, you were speaking about seeing patients, days in a row, 4, 8, 10 days in a row to work on this. How critical is that aspect of being able to see patients in subsequent days to the care that you're able to provide?
Yeah, we really started this approach because we saw, number one, it was a little easier. The magnitude of cases, like the severity of cases that our clinic has become known for, requires us to have a little bit more of a threshold approach, right? So, you might call it, like in energy medicine, called like an energy of activation or a treatment threshold before the body starts to respond. And you have to meet that before the body will shift. Well, allowing us to treat somebody for 1 or 2 weeks, and sometimes severe cases 3 weeks in a row, allows us to hit that threshold response so that the body can start to heal. And it also gives us a ability to adapt day to day, like I was talking about. If I start your body on some sort of immune support, detoxification support one day, I can see how you're doing the next day and adapt that. If it turns out that it seemed like you were going to tolerate it just fine, but you couldn't, I can change that right away. You don't have to wait a week. Or, what happens to a lot of patients is they'll just stop taking their remedies if they don't feel good with it. And then they might not tell their doctor for 2-3 months. Mm-hmm. And then the doctor say, well, how'd you do? I did terrible. Well, how's your protocol going? Oh, I quit after a week. Well, we can adapt that so the body can respond the next day. And so it allows us to make those adjustments. So it allows us to see a very quick shift, very fast. And so, I have some practitioners who refer into us, and what they'll say is, sometimes I like to send my severe cases to you because what it would take me 6 months to accomplish, you can do in 2 weeks. And then we send them back, right? They go back to their local practitioner to keep them running, but they come to us so we can get them over that hump and get a lot accomplished very quickly.
Great. All right. I want to, there's a lot to think about and perhaps explore more, but I will honor those who submitted questions ahead of time and turn to those now. We have quite a few. Why, one sent in from Sue, why are there so many negative tests for Lyme that show up positive, months or years later? There is a follow-up question, but let's start with that one.
Yeah, so one of the mechanisms with that is what's the load? Like, is it enough that the body actually has to respond? So most Lyme testing is basically looking at your body's response to the bacteria, right? So is there enough of a load for it to respond at that time? And is your immune system strong enough to respond? 3 would be kind of what we talked about today. They're shifting so quickly. Right, especially Borrelia, is shifting its antigens, it's forming biofilms, it's changing into cyst form, which might not be able to pick up. And then as well, at that point, later on, either you maybe have done some treatment, or the body's at a point now where either it doesn't necessarily, it can actually deal with it, or it's such a weakened state that the Borrelia has gotten to a big enough level that it can't avoid detection by the testing. And then as well, the Borrelia doesn't want to stay in the blood if it doesn't have to. It wants to go where the food is. And most testing is going to be via blood. And so you're gonna miss out on those critters. So there's ways to bolster that and different tests you can use, but that's the gist of why there's so many false negatives.
Thank you so much. Sue's follow-up question was, what are the long-term symptoms that patients tend to experience if it goes untreated?
Yeah, there's a typical Lyme stuff like brain fog, joint pain, Lyme arthritis, they call it, malaise, flu-like symptoms. That can, rashes. If it stays untreated, it depends on kind of what your constitutional weaknesses are. It can go neurological and turn into like twitches and tremors and zips and zaps and nerve pain and intense brain fog and things like that. It can go more towards a joint perspective. I've seen some long-term patients where it's infected their like enteric nervous system and creating IBS. And so it kind of depends on your constitutional weakness, but basically just magnifies its typical symptoms, and autoimmunity is, for long-term Lyme, is pretty common.
Okay, and I know you just listed quite a lot of conditions there that could result affecting so many major systems. Is rheumatoid arthritis among those that might manifest as a result?
Yeah, especially, so rheumatoid arthritis is the body starts attacking the joint itself, and especially some of the synovial fluid in the joint. And so, Lyme is going to love to hang out in the connective tissue, love to eat collagen and things like that. Mm-hmm. So it's going to go to the joints. And if it's there long enough, the immune system will get confused and start to attack itself. Now, mycoplasma is one of the co-infections, and it's a known cause or a trigger, I should say, of rheumatoid arthritis. So I also see that one quite often. But Lyme as well is a great mimicker and can trigger autoimmunity like RA.
Okay. Thank you. That was another question that had been submitted ahead of time. Another question sent in by Jane asks, does everything that you've discussed today apply to other tick-borne illnesses? And in a way, I think you've answered it, but just to honor the question and be quite clear here, does everything you've discussed apply to other tick-borne illnesses?
It does for sure. I would say, this is not an absolute statement, but Borrelia tends to be the most cunning with its ability to change shape and antigenic variation and things like that. But all bacteria on some level will use the different modalities, communication, quorum sensing, bacterial synergism that I talked about today in biofilms. Yeah. Great.
I'm going to turn to a few questions in the chat, and then I'll come back to those submitted ahead of time because they are quite relevant. Babette has asked about tick testing. Is this something that you would recommend?
I think what you're referring to is like if somebody gets bit, test tick. It's not a bad idea. Yeah, it just to be ahead of the game. And I tend to have my patients, I'll put together a small protocol for them, maybe some herbals and essential oils to put on right away as well. But testing the tick is a good idea.
And what information could you glean from that you find valuable?
If you knew for sure that the tick had like Borrelia in it, then you could immediately say, okay, I'm going to stay on this. Instead of thinking like, it's like if a patient of mine gets bit, I might just put them on like a 5-day protocol, right? But if you knew for sure and you weren't necessarily like a patient of mine, you might say, and of course you have to seek your own healthcare advice, but you might say, okay, I'm going to do something for 30 days if I was bit by this tick, knowing it had Borrelia in it.
Okay, very good. And you did just mention putting some herbal remedies and things on. Are there any that are safe for general use for someone who's been bit by a tick and is now worried about infection?
I would say there's some general safeties, like right on the tick, you could do some different things like some palmarosa, palo santo oil, tea tree, some thyme, marjoram, things like that right away that you tolerate. Different herbal blends that I found patients work. The J Neutral company has some things like Borrelia and Lymogen that most patients tend to, it's herbal blends that do well with. I would probably do something that's be a safe bet is like maybe a little bit of skullcap and cryptolepis herbs, but that has to be very specific to you.
Great. And I do appreciate all these questions that people are asking. I'm going to ask a few more and then make sure I get to those submitted in advance. But let's see, I've got someone asking if there's a test you feel that folks can get a reliable diagnosis from.
For Lyme disease, Borrelia specifically, my favorite test is the Felix test from Red Labs. They're a Belgium company. It's a very specific test. It tests for the bacteriophages, which are the viruses that infect Borrelia. That's a DNA-based test. So basically, if there's bacteriophages there, the bacteria is there. If they're not, they're not. And it covers a pretty broad spectrum of species of Borrelia. So for instance, we found that many patients had actually relapsing fever who only thought they had Borrelia burgdorferi. And so that test is probably one of the more sensitive tests. I would say one thing you can do to enhance those type of tests is before you give the blood or urine or whatever you're going to do something like sauna, deep tissue massage, or exercising to try to mobilize things in the tissues. Okay, try to enhance your ability to get a true test there.
Good to know. Okay, I've got a few questions here about treatment. One was submitted in advance, and they are asking, is there a possibility that biofilm can completely prevent treatment from working? And if the answer is yes, then what would be the best strategy for dealing with this situation?
Biofilm is only going to protect what's inside the biofilm, right? So it's not going to completely inhibit treatment, because if something's outside of the biofilm and thereby causing a lot of problems, whatever you're doing is going to address what's outside of the biofilm. So it won't completely negate treatment, but it does greatly reduce effectiveness of treating and dealing with the microbes that are inside the biofilm, okay? So especially, antibiotics are real, they're great in life-saving scenarios. I know they've helped a lot of my patients sometimes. But one of the things they do is they very quickly force things into biofilm formation and into cyst form, right? Almost instantly. It enhances those things. So the more you just haphazardly use antibiotics like that, the more you're promoting biofilm and cystic form formation. And so if you needed to deal with biofilms, you would use some of the strategies I talked about earlier, certain herbs, essential oils, maybe some nutrients like proteolytic enzymes, EDTA or NAC, N-acetylcysteine, to help to degrade them, but slowly, strategically, mindfully, and dealing with them, to know what's happening. And in my experience, herbs are quite amazing because the plants are adapting in nature, right? So they're changing their constituents as we go. And then most herbs are going to have some degree of biofilm penetration. Okay.
All right. Good to know. I see some questions that probably have us coming back to this topic in a minute here, but as we're talking about treatments, Vivian had asked in advance for your evaluation of medical ozone as a potential treatment for Lyme disease. What are your thoughts on that?
Yeah, I mean, ozone is going to attack the back. It's going to break down some of the bacteria. It could potentially break down some biofilms. There's lots of options. You could do IV ozone. You could do nasal ensulfuration, rectal ensulfuration, all sorts of different things. I would say, in my experience, as far as like or different pheresis type treatments where they take the blood out and ozonate it and put it back, that really depends on the case. I wouldn't say overwhelmingly it's been amazing for a lot of my patients. Mm-hmm. Some of them that have like intestinal parasites, I like rectal ensulfuration. But as an overall for Borrelia, I would say if it helps, if you try it and you use it, go for it. If it doesn't seem to make a major difference, I'm not super wowed by it all the time, especially for the same idea of testing. It's getting in the blood, and if they're not in the blood, it's it's not gonna get after the creatures.
Okay. And then Vivian had also asked about for home-based use, can light and or frequency devices help Lyme patients?
Yeah, a lot of different, I have some of my patients, they purchase lasers. There's a couple different lasers I like that are helpful on that front. There's different like red lights and Juve lights and things like that are helpful. The very frequency specific devices, microcurrent, some of the Rife machines, things like that, use sound or light or microcurrent waves. A lot of my patients get a ton of benefit out of those, and sometimes I'll help them develop programs. If you're going to use it directly to support the immune system in dealing with the bacteria, I would say be very strategic with when you use it, how you use it. Don't go all willy-nilly. More than not, I'll start my patients on things like direct organ support, like supporting the organ or the brain, or like inflammation support, rather than trying to use it to disrupt the bacteria themselves at first until the body's ready.
Okay. Susan had asked, notes that Western medicine treats Lyme with high doses of antibiotics and asks, is this something that is necessary?
Well, in my experience, no, it's not necessary. We see many of our patients who are dealing with Lyme disease, and when they come to our clinic, they've never used antibiotics. They never use it to address the Lyme disease, and they get well, right? That's not our paradigm that we use, and it's not what we see experientially in the clinic. I recognize that for some things it may be necessary, especially acute life-saving instances. But in my experience, it's a scorched earth policy, right? It's a napalm on the body. Mm-hmm. You need to really decide if that's the route you need to go, if it's that severe.
Yeah, and we have a few more questions that I promise I will get to. And I know I am watching the clock here, but I'm sure, well, at least it's my feeling as I'm listening to you, I do, having heard from some number of patients who've had success at Biologix, I do, have some general level of trust for the body of knowledge that you have, and then, that the practices there, they seem to make quite a difference. But you're in Tennessee. So my question is, some of these technologies that Dr. Jernigan and you all utilize or practice, are they available elsewhere? And do you know how one might go about finding some of these things that seem to make up a significant part of kind of the puzzle of solving for severe Lyme?
Yeah, I mean, there's some of the technologies we're using that were innovated here, and we're the only ones doing neurophotonic, neuroimmunization, biospectral testing. Those are pretty unique. Innovation is one of our kind of values in the clinic, so those are pretty unique. But, frequency-specific microcurrent, frequency-specific laser, different forms of like biofeedback. There's other clinics around that are doing those things. There's other clinics around that are taking systemic approaches, systematic approaches that I think are helpful. And I know there's other clinics around that are kind of centers like us that are doing good work. Mm-hmm. So I know there's some of those in the different regions that are doing some of that. And I think there may be a couple other practitioners you've had on to have some centers like that I think are doing legitimately good work. Yeah.
Okay.
Yeah.
Probably just a question. I know someone had asked about the BioMed Center in Providence, to which I'd say you probably need to call and talk. I think as much depends on their technology as well as their personnel and their, their experience and training. All right. Kathy asks or notes that rheumatoid arthritis is affecting years after severe Lyme. Should this person treat for rheumatoid arthritis or Lyme, or is there some treatment that addresses both?
Yeah, I think you could, you would address both, right? So autoimmunity is about modulating the immune system and then dampening down inflammation. And there's no problem doing that while you're addressing the body dealing with an infection. So first, you would want to make sure, is there any microbe that's still active that you need to deal with? And to some degree, sometimes what happens is an intense infection like Borrelia will flip the immune system. And even after Borrelia is gone, it never flips back. And that may be what's happening, or you may still have the infection. You have to sort that out. But, you just modulate the immune system and you lower inflammation is the way to do it. And you could do all that simultaneously if you needed to.
Okay, and actually I'm going to ask another follow-up question to that, which is when you are treating someone with Lyme, obviously you're trying to clear the bacteria from the system. Is there a realistic expectation of there being zero of that bacteria, or is it more about the good bacteria severely outweighing the harmful bacteria?
Yeah, so number one with that is, do you need to clear all the bacteria to get better? Absolutely not. Some of our research that we just published in the Curious journal does show that we were able, at least as far as our testing could tell, get them down to zero. But in our experience, long before we were doing that, you don't need to get it down to zero. What you need is to get it down to a load well enough that the rest of the microbial environment and the rest of the body systems are up and functioning, and it just washes into the background. It just becomes a small weed in the garden, and it's not hurting anybody.
Perfect. All right, Benoit asks if there are any go-to treatments, supplements, or herbs that you see as particularly effective. You talked a little bit about this, but I know Benoit actually does some work with herbal remedies to support those with Lyme. So I'll put that question back to you.
So he just general treatments to support the Lyme disease patient.
Yep. Any go-to treatments, supplements, or herbs that have been particularly effective?
Yeah, I mean, for sure, supplements on that front are going to be very unique. I would say one of the things we've had as a go-to lately is our induced native phage therapy. But from a more herbal standpoint, a lot of it depends. But I really like some of the J Neutral line. They've got some really good products that are herbal blends that are very unique. Limagen, Borreliagen, Microbigen. Those are great. I'll use Alternea, Astragalus, depending on the patient. Cryptolepis, Skullcap is a very good harmonizing one that really lowers the inflammatory and cytokine storm for a lot of these patients. So those are some good go-to ones. Japanese knotweed and Andrographis have great effects on the spirochetes, and also have some antiviral properties and histamine lowering anti-inflammatory properties that make them synergistic. And so that's the route. On the herbalism route, I'm typically looking at three fronts. Does it deal with the bacteria directly? Does it support the immune system? And can it deal with the cytokines that the bacteria are initiating? And so the blends that we're creating are very custom blended to that patient and their situation, using the biospectral testing to help us blend those and our clinical knowledge. But those are some go-tos.
Okay, I appreciate that. All right, and it looks like maybe this is our last question. Do you have any recommendations for someone suffering from POTS? It sounds like this person has done some sea salt added to water, but is curious if there are other recommendations you have.
Yeah, so POTS, POTS first and foremost is tend to going to be like what we call a neuroendocrine response. It's the way the nervous system and the endocrine system relate together. And then if the body can't respond to stress, like the stress of standing up, for instance. So POTS patients, they'll stand up and then they don't get enough blood pressure to the head because the nervous system and hormone system don't respond, and they get lightheaded or dizzy. The heart rate goes up really high and blood pools. So, it could be an infection driving that response. Number one, you got to deal with that. But you tend to, and in my experience, you have to support them directly. So lots of electrolytes and fluids are going to be number one. A lot of times they have low blood volume. That's going to be number one. And then supporting the stress response would be number two. So you could do that supplementally or herbally. You could support their adrenals, vitamin C, adrenal glandulars, B5, things like that. You could give them adaptogenic herbs that are going to help the body deal with adaptogen licorice. That's going to be good. And you need to help them deal with stress on like a neuro-emotional level. So I use a lot of tapping with my patients, or I'll teach them some limbic retraining steps or meditative techniques, things that are going to help them also deal with stress on that neuro-emotional level. That's what I would say. Is there an infection driving it? Support the body in dealing with that. Support the neuroendocrine system directly with supplements, electrolytes, water, herbal support if that works, and then deal with the neuroemotional component.
Excellent. Not surprising after your talk on the 4 quadrants of health. If you haven't heard that talk, you can find it in our BioBites archive. All right, this brings us right up on the hour. Deborah asked if you treat patients remotely or virtually. I will go ahead and offer that. And I'm going to put a note in here for our next month's BioBite if you're interested in the link. But sorry, Dr. Hart, do you see patients remotely?
We start with patients virtually. I'm not virtually. We start with only patients in person, so we can make sure we get a good start. And then established patients, we will do phone consults if they don't have a practitioner back home to work with until they could get back in for a visit or whatnot. So not initially, we don't offer a virtual medicine program, but established patients, we do offer phone consults, like a online coaching. Mm-hmm.
Dr. Hart, haven't we, I do think that you've seen patients where they'll go and they'll stay with you for like 2 weeks, or a week or something and stay there. And then you're able to treat them from afar, or maybe even connect them to other centers that are able to do some of these technologies. That's worked in the past, right?
Yeah, I do. I've really worked hard to try to form a referral network. Because overall, and I kind of mentioned this before, I want patients to have somebody to go to back home. I mean, we're primarily a destination-based clinic. People fly in to Franklin and stay with us that time being. And so I want somebody to have somebody back home. So I am building a referral network for as many of the major areas. So if a patient comes in and says, John Doe is my doctor and he's great, I'll usually try to get a hold of him, get to know him a little bit. And if a patient has a good experience with them, then I'll put them on a referral list if somebody else is in that area. So yeah, we've done a lot of that. Mm-hmm.
Well, we definitely need to connect with you on that, because we've got our BioMed network, but we also have sort of a little bit more of that local resource, like,
I would love that. That'd be great.
This person have this PMF now, or, the different therapies that you might want to be able to send. So yeah, we'll connect with you on that.
Perfect. Deal.
Awesome. All right. Well, thank you everyone for joining today. And thank you in a special way, Dr. Hart, for giving us this hour and all of your expertise and experience to help guide us. We appreciate it. And we hope that you might consider joining us next month on April 5th, when we'll be exploring the biological approach to cancer and the question of whether it is curable. And that'll do it. So thank you very much again. We'll look forward to having you again in the future.
Take care, everybody. Thank you, Liz. Thank you, Katie. Take care, all.
Thank you, Dr. Hart. We always love having you. That was great. Thank you.